How often do I need to see my psychiatrist? So, how often do I see my psychiatrist? So, yeah, it all depends. And I actually get this question basically every day, all the time, which is, how much of seeing your therapist or how much of seeing your psychiatrist is quote unquote normal. And I don't like the term normal, so let's say typical. And it all depends. Whoever your clinician is will sit with you and they're going to go, hey, here's what I think is going on. Here's how often I think you need to see me, especially in therapy. They will literally, most times, lay out the whole entire thing. They'll go, let's set some treatment goals and let's get some framework. Let's get some rules about what I think can happen over how much time. And generally in therapy, they will see you every week to every other week for months. Sometimes it's 2 or 3 months. Sometimes it's longer. It just depends on the situation. And then psychiatrists are no different. So when a psychiatrist sits down with you and they talk to you forever, and then they get all the information that you put in your forms and all that stuff, their goal is to try to anticipate how often you need to come in. And at the end of that first appointment, they're going to go, hmm, I think you need to come in next week, or I think you need to come in a month. Now, because of the way that our system works, it's going to be pretty rare and uncommon that you're going to see a psychiatrist more than once a month, unless you're in a specialized program. And we have videos about the different levels of care in the mental health realm. So make sure that you subscribe to the channel and check out all our other clips and stuff, because I know I've talked about that before. So I won't go into that with this particular one. But yeah, it all depends on what level of care you're in. And in this case, since I'm an outpatient doctor, generally I see patients once a month to every 6 months, just depending on age and situation. There are situations where psychiatrists will see their person once a year or once every 9 months. But again, it all depends on your psychiatrist. They will tell you kind of their practice guidelines and their practice philosophy. Yeah, they want to make sure that you can be able to stick with the program and be able to afford the program and know what the expectations of the program are. Because that just increases your risk of being the chances of you being successful with your treatment. And so, how often do you see your psychiatrist? As often as you need to. Now, there's an asterisk caveat with that because there are times where we, as psychiatrists and clinicians, we don't want you to be in every single day. We don't want you to be calling every single day, because then that means that you actually may need more help and a more structured setting. And so I give that caveat, because if you're like, oh, I want to see you every week, sometimes you may get pushback, and your clinician may go, whoa, hang on, no, I need you to try all those tools that we talked about. I need you to work on all those coping skills that we talked about, so that then over time we can increase the amount of time between our visits, so that you don't become over reliant on me or over reliant on your therapist, because the ultimate goal is kind of that autonomy and having more control and more agency of yourself and your life and that sort of thing. And so, yeah, so there's a push and pull between expectations of between patients, clients, and therapists and psychiatrists. But the key is communication. Communication is everything. Let your person know what the expectation is, and your clinician will also help what they expect of you. And if everybody meets in the middle, magic happens.